My name is Denise, and this is a dissection of a sheep's heart for Anatomy 2. This is the apex of the heart, and this is the base. The base is a point of attachment for blood vessels entering and exiting the heart. Within the heart, we have the atriums, and the ventricles. The ventricles help pump blood, where the atriums receives the blood. Within the atriums, we have the auricles. The auricles essentially helps increase atrius capacity to hold on to blood. The auricles are on both right and left side of the heart. So within the right side of the heart, we have the tricuspid valve here. And the tricuspid valve essentially, like other valves, essentially decreases the potential for backflow from the atria. Basically, it prevents backflow from the atria to back to the ventricles again. And similar to the bicuspid valve, that's what it does as well within the other side of the heart. Within the heart, we have the aorta and then the pulmonary trunk. So we have the aorta right here, and then we have the pulmonary trunk right here. Within the aortic and the pulmonary trunk, we have the aortic semilunar valve. Aortic semilunar valve right here, and then we have the pulmonic semilunar valve. So for oxygen to leave and go up into the deoxygenated blood to leave and go up into the head and the neck, etc., it usually goes through the left atrium and then up into the aorta. But I'm just gonna go through here, so a bit easier to see the demonstration. You can see it goes through here, and that's how the oxygen goes up into the body, into the top portion of the body. Didn't say previously, but the aorta helps transport oxygenated blood, oxygen-rich blood into the entire body, and those semilunar valves prevents backflow, similar to the tricuspid and bicuspid valve. So within the left side, we have the bicuspid valves. Bicuspid valves does similar things to the tricuspid valve, which is to prevent backflow. In the bicuspid valve, it's a lot easier to see the core tendinae, which connects the leaflets of the heart, and then we see the papillary muscles, which is basically anchors the core tendinae to prevent prolapse of the valves. Things not seen on the heart are the superior and inferior vena cava. Superior vena cava carries deoxygenated blood from the top part of the body to the heart. Inferior vena cava carries deoxygenated blood from the bottom part of the body to the heart. We do have the coronary arteries on here. Coronary arteries, as you see, delivers oxygenated blood to the heart. We have the veins, not necessarily seen here, pretty difficult to see, but carries blood towards the heart, whereas the arteries usually carry blood away from the heart. We also have the brachiocephalic trunk, which we can't see on here as well, but they supply oxygenated blood to the upper part of the body, like the neck, head, etc. Lastly, we have the atrioventricular septum, which essentially separates the ventricles, the left and the right ventricles, to prevent deoxygenated and oxygenated blood from mixing.